Hi, Professor Distasio. This is Alex Cruz. This is fatigue on patient safety, impacting medical errors, adverse events, and malpractice incidents. Kaiser University. This is the interdisciplinary capstone project PowerPoint presentation. In my oral presentation, we're going to be talking about the effects of fatigue, feelings of tiredness, lack of energy or exhaustion, short-term memory lapses, and the use of other studies and other industries which have fatigue as the number one cause of fatal accidents. Healthcare practitioner fatigue. Work demands before 2003, 24-hour consecutive shifts, ACME regulations, first-year residents only, staff shortages, increased physician to patient ratio, and a study by Barger and AS 2006 on 2,737 physicians who are affected by fatigue. Sleep cycle. The sleep cycle is the period of time when one is at rest out of a conscious state, usually 6 to 8 hours. And the most important point I want to look at here is the circadian rhythm. Circadian rhythm is a 24-hour cycle of normal biological processes which restores normal hormone levels needed to function. Cognitive functions, concentration, attention to detail, problem solving are all affected by the lack of sleep. What is fatigue's impact on medical errors? Research by Caldwell 2008 demonstrates the impairment areas of timing, accuracy, multitasking, and difficulty performing routine tasks after fatigue sets in as a cause of medical errors. Medical errors have affected 44,000 to 98,000 people each year die in hospitals. It's a very serious incident. A study by Barger 2006 concluded resident physicians who work consecutive 24-hour shifts were at more risk for medical errors and adverse events and attentional failures. So that's fatigue's impact on medical errors. Okay, the pivotal case is on Libby Zion in 1984, who died within a few hours of admission to the emergency room in New York Hospital. Fatigue was seen as a factor due to residents who were on the case and working 36-hour shifts. A calamity of errors contributed to the death, but the fatigue factor was the main cause. So that was a pivotal case. Fatigue's impact on medical malpractice in the 21st century. As recently as January 1st, 2011, fatigue was linked to the danger of physicians performing surgery who are sleep deprived. Statistics release the operating of a patient while fatigue is compared to having a blood alcohol level of 0.1 while driving the car. This is very serious. Also, the American Council for Graduate Medical Education opposes views and resistance to changes of the IOM recommendations, which is the Institute of Medicine. Basically, 80 hours a month, the first-year interns have to work. They got reduced from 24-hour shifts to 16-hour shifts and have 5 days off instead of 4. And it has not gone far enough to help the situation. The ACME changes after the IOM recommendation. What are the strategies to decrease fatigue? The strategies to decrease fatigue are reduction of consecutive 24-hour shifts, stress management programs creating environmental adaptations, a fatigue risk management screen for our employees, which was done in Queenstown, Australia, was excellent, larger on-call pools for staff relief, and schedule swapping for employees working over their shift. Results of changes suggested by the IOM. IOM recommendations have reduced work shifts from 24 to 16 hours, 48 hours off for residents after 3 to 4 consecutive nights, and moonlighting by residents is counted against the 80-hour per month limit. Now these changes in the medical errors with the new regulations. United States medical errors have declined to 37%. As a result, the quality of care patients has not declined by the Department of Health and Human Services. And this is a very important point. Many of the ACME regulations are not enforced in some healthcare institutions, affecting reduction of medical errors. Increased training of staff is needed during patient handoffs prior to medical procedures to avoid haphazard patient safety issues. And Rothschild talked about 6 hours of sleep before a surgical procedure affecting physician fatigue. And last but not least, the system's approach to reduce medical errors, adverse events, and malpractice. Errors being reduced by computerized technology is a possible solution. The use of a computerized physician audit system, reducing medical errors from 55% to 86%, Dexter 2001. Oregon hospitals have used a surgical improvement program, a pressure ulcer prevention program, and a patient safety culture survey. And in conclusion, fatigue is a significant factor in medical errors, adverse events, and malpractice suits. All the studies indicate sleep deprivation affects physicians' performance during medical procedures. Okay. This is Alex Cruz, and this is my oral presentation. Thank you. Have a great one. Bye-bye.